Well, good afternoon, everybody. Again, I echo Margaret's welcome and thank you for joining us. And we're so excited to have this discussion with four very esteemed panelists today. As Margaret mentioned, this panel was organized by Health Justice in Action, which is a student group that was started in the program in public health, but it's open to students across campus. And they actually, I think, will have a sign-up sheet circulating around for anybody who's interested in finding out more. Please sign up and give your information and find out how you can also be involved. The students of HJ have really been instrumental in getting this panel started. And they've been wanting to do a panel to facilitate a discussion among public health professionals and researchers about what the impact of this new administration and the political and economic and social implications of the 2016 election mean for public health. But in particular, for the health of communities who are, I would say, even in the best of times, face and sort of shoulder the largest burden of health in our society. And health, and by extension, health disparities, are affected not only by health care and medical utilization, but are the product of the distribution of resources and status in our society. So even though a policy or a certain event may not appear to be directly related to health, its reverberations are profound enough that they can impact health and wellness. So this sort of panel was something that we had discussed very early on, but the truth was that I think nobody really knew exactly what to anticipate. But here we are now, over 100 days since the inauguration, and I think we have a stronger sense of what the priorities of this administration are and what lies ahead of us for our work as public health professionals and researchers. And on that note, I am so pleased to introduce you all to our four panelists today. Sitting directly next to me is Ms. Stella Kim. And Stella is the Senior Manager of Community Advocacy of the California Pan-Ethnic Health Network, also known as CPEN. CPEN is a community-based organization whose mission is to promote health equity by advocating for public policies and sufficient resources to address the health needs of communities of color. Ms. Kim is a graduate of UC Berkeley and holds a Master's of Public Policy degree from the UCLA Luskin School of Public Affairs. Prior to CPEN, she worked as the Western Director of Strategic Campaigns at Young Invincibles and advanced statewide policies and legislation to fight poverty at the Center for Community Change's California Partnership Project. So welcome, Stella. Thank you for coming. Next to Stella is Dr. Brittany Morey. Dr. Brittany Morey's research focuses on how on how social and physical environments impact health disparities, especially for Asian and Pacific Islander Americans and immigrant groups. Her research has examined how living in ethnic enclaves affects breast cancer risk for Asian and Pacific Islander women. She was formerly at UCLA, and in July, Dr. Morey will be a Chancellor's Postdoctoral Fellow at the UC Riverside School of Public Policy, and continuing research on how immigration policies affect health for ethnic minorities in the U.S. Next, we have Dr. Sami, who does not need an introduction for many of you here, but I do want to just highlight many of her accolades and her accomplishments. She's a project scientist and lecturer in the program in public health here at UCI. She's worked on socially and environmentally sustainable planning, public policy, and research in partnership with both communities and intergovernmental organizations for over 20 years. Her research is embedded in community processes and partnerships at the intersection of health, urbanization, and social justice. Dr. Sami earned her PhD in urban planning, policy, and design from UC Irvine with a specialization in healthy and sustainable planning processes and public policy. And finally, last but not least, we have Dr. Michael Montoya, who's an associate professor here at UCI in the School of Social Sciences, and his research focuses on exploring the boundaries of biomedical and social sciences in order to find a critically integrated approach to solving health disparities among Chicano and Latino communities. Dr. Montoya's research focuses on the relationship between the creation of medical scientific knowledge on complex diseases and social inequity. He has noted that this research interest in the social context of disease is a central question in medical anthropology and has significant implications for healthcare and treatments available for historically disadvantaged communities. So thank you all very much. These are all very impressive biographies, and we're so happy to have you here today. So I have some questions prepared, and I'd love to hear your responses for each of them. But I also want to encourage dialogue among yourselves, and so if there's a comment that you want to make or something that you want to add on to something that's been said, I encourage you just to talk freely and let us sort of eavesdrop in on your very enlightening conversation. But I want to start first by sort of asking you all to take stock and think back and take a look since the election, and maybe even before then, if it's pertinent, and share with us any challenges or changes or shifts that you've seen or noticed in the communities that you've worked with. In other words, what's happened since the election? You want to start, Stella? And you can share the microphone or move it along.
Great. So, as you mentioned, CPEN, we are a statewide health policy organization that works specifically on fighting health disparities and reducing health inequities. So for us, it's been a long fight. And actually for CPEN, the way that I first interacted with CPEN is when I was a national healthcare organizer on the Healthcare for America Now campaign in 2009. And that's how I first ran into CPEN. But CPEN was actually vanguarding, making sure that communities of color were represented in that fight for the Affordable Care Act, that there was a conscientiousness around cultural and linguistic appropriateness, that language was considered, that we really thought about California. So I think what the challenge has been for us is that California has been making really great strides, but obviously California is not an island, California is not alone, and we had been really advancing policies to include linguistic and cultural appropriateness, thinking about reducing health disparities. We recently hired a dental director in the state of California. A lot of things at the state level we're moving and advancing. For example, we also have Health for All for children, right, through Medi-Cal as well. So I think for the advocacy field, we really felt like there was a lot of success, and we were looking forward to another year of making those wins and those fights meaningful, but also actually winning them. So post-election, I think it was a really stark reality check for a lot of folks in California in particular, because the state had been making such great advances, and now we're really reeled into figuring out all the mess that the federal government and the federal administration, in terms of the policies targeting low-income communities and communities of color, that we're really vitally connected. And all of the state funds are connected to national funds. All of the programs that we have as public service programs are connected to national programs as well. And I think there's a lot of environment of fear, for one, because folks in the communities don't understand necessarily what specific policies affect them. There's a lot of rumor mongering, a lot of anger and fear, and I think actually in terms of mental distress around being deported or records being exposed with your health records and then you're not being able to get insurance, or just because you're a person of color or you have a different sexual orientation, you are literally going to be discriminated against in every way. So that's been the greatest challenge, that there's a lot of unknown, and for communities of color, there's been a lot of advances made, but now we're really having to assess where we're going and what these things actually mean and how we're going to fight them.
Well, thank you for having me here today. So my research focuses on how immigration policy impacts ethnic minority health, and I'm at the beginning stages of this research. But I started forming some of these ideas 2 years ago, so before we even had presidential candidates yet. When out of the Republican Party and out of certain candidates, we started hearing some of this rhetoric, this anti-immigration rhetoric, this talk about illegals, this talk about anchor babies, that really started striking a chord with me about how these campaigns were starting to build. And surprisingly, and much to my horror, and I'm sure many of the people in this room, a candidate rose to the top who built a campaign on rhetoric like build the wall. And not only was this the rhetoric of a single person, but for me it was the shock and unbelief that so many normal Americans rallied around this battle cry. And to me that this is just an indication, it struck a nerve, where perhaps we were a little naive, or perhaps there's been this undercurrent of xenophobia, this undercurrent of racism, that this presidential candidate was able to really latch onto in order to win a campaign. And so, since the election, of course, we've seen huge implications for communities. And I would just say, even before a single brick has been laid, even while the Muslim ban has been caught up in the judicial system, these policies, this rhetoric, I think is really a form of structural racism that we're seeing. And so we're seeing things like increases in indiscriminate deportations. And we're seeing things like spikes in hate crimes, in anti-Semitism, in 2 men in Kansas being shot, and one of these Indian men being killed. And so we're seeing all of these, and I would suggest that this is even just the tip of the iceberg that we're starting to see. And we're even seeing things like in the Latino community, decreases in the number of reported police reports about domestic violence, about rape, about interpersonal violence. And so we're seeing these just have huge public health implications for our communities before even actual legislation has happened or has been put into place. And so these policies that are coming down are really echoing to me just the structural racism that exists in our society.
There are so many different levels that I feel like we're addressing here at the structural level, at that level of fear. Something that my work has done, working on OC Pitch, the Orange County Partnerships to Improve Community Health, I am embedded in Anaheim, Garden Grove, and Santa Ana. And I can tell you that there's so much complexity around the impact of the inauguration. The fear of science has kind of ingrained itself throughout the community. And that is impacting vaccination rates, that is impacting so many different levels from that level. So that kind of rhetorical level, this kind of fear is affecting it on that level, but we're also seeing an effect on service provision. So in Orange County, for example, what we're noticing is that the Muslim community, the new immigrants, are not going to the food banks because they're worried that they're being surveyed. We're seeing that Latinx communities that are undocumented are not seeking health care. And we are experiencing a spike in rise of chronic diseases linked to mental health crisis, the stress of children throughout the county for losing parents to deportation, for example. These things are real, they exist, and I want you to be aware that we are aware of that. And we have to address that. But because this is complicated, I want to give you a perspective that surprised me but didn't surprise me. And that is the development of resilience has strengthened and fortified in ways that I have never seen in Orange County, and I've been here for about 10 years now. Let me give you an example. The day after the inauguration, I taught a class that quarter, Tuesdays, Thursdays, and the day after the inauguration, which was a Wednesday, I thought, I wanted to bury myself under a hole and a rock and I didn't know what to do. And I was like, you know what I'm gonna do? I'm gonna go to the communities that I've been working in, and I'm gonna go hang out with the young people just to see where we're at. And I got there and it looked like everybody else had the same idea. We were all so energized, and we have never been so adamant about making change at the local level. So I have to tell you that with all the complexity that we're addressing, the empowerment that I feel on the ground, the energy that I felt that day, we stayed up till 2 a.m. and came up with a plan to make Santa Ana skate-friendly by 2020, because we realized that skateboarding is missing in active transportation, and we had to put it on the map, right, Ian? Because we got to skate it all. We have to skate it all, including UC Irvine. So I realized that suddenly these mundane issues of active transportation suddenly became rallying cries. Skateboarding became an act of resistance against the structural racism, literally structural, and structural, if you can think of it that way. So I wanted to put that out there, that even with the fear and the lack of trust, we are seeing an empowered citizenry coming up and saying, basta. No more, it's enough. We're gonna make change at the local level.
Thank you for having me here, and it's an honor to be on this panel. It's great to be sitting next to Mo again. It's been a while since we've worked together or hung out. I want to build upon what everybody else has said. I won't sort of rehearse the facts and figures about the vulnerabilities that people are experiencing, the atrocities, the very real targeting that's going on, the very real fears that that people are having to swim through, except to say, I'm not sure if it's that different now than it was before. Mm-hmm. That people have been living under extreme, intense surveillance, and they've been targeted, and they've had violations of every kind that you can imagine for decade upon decade. We didn't get here, and the president wasn't elected because of some fluke. It was part of a process that occurred that we are all still maybe shaking our heads as to how. But I do want to build on what Mo said, which is the resilience also was building before. And that what we're now seeing is a crystallization, a mobilization of those resiliences, and there's 101 different ways to be resilient and to organize around them. There's almost as many different ways as there are people. But I want to talk a little bit now about a different community that I work with. So yeah, I work with neighborhood communities around Orange County and have been doing so for over 10 years, and I can certainly affirm what has been said. But there's another community that I work with that I care about deeply, and that's you all. And one thing that I have noticed is that you all, students and advocates, are themselves feeling increased vulnerability. There's a vulnerability about what should I do? How should I be? What should I say? Who should I contact? When I'm there, what do I do? Will it make a difference? What am I doing with my life? There's those questions. And then there's the questions about, I live in a mixed status family. I'm worried about my mom, my dad, my brother. And then there's the question of, I'm hungry. I don't have health care. I'm home and housing insecure. Or I'm a DACA student. I'm worried. So I have seen, in addition to out there, right here in this room, we all are impacted by this. We all have degrees of vulnerability that we carry with us, and it is going to wear upon our well-being. How can it not? And one of the things that I like to talk about in terms of resilience is to have us really recognize that we too are vulnerable. Because if we don't get in touch with the vulnerability that we all share, either as advocates or as personal people because of status or access or lack thereof of resources, then when we think about those communities out there, we put a distance between us and them that they don't need. They're not asking for that distance. That puts us as somehow more powerful and then denies the resilience and the movements and the wellspring of creativity, innovation, and power that is, to quote Sami, being unleashed at the moment. So that's sort of one thing that I've observed, and then a reflection upon if we get in touch with the ways we are intimately, personally connected to those vulnerabilities, it's a good step for being able to accompany people in the unleashing of their power.
Thank you. That was very well said. I feel very inspired. But so actually one thing, if I could just pretend that I'm a panelist for a second and answer this question for myself and maybe get some of your thoughts too, is as a researcher, I feel like there has been an explosion in interest in certain vulnerable populations. And this can very easily be a double-edged sword. And I just want to say, I really appreciated what Dr. Montoya and Dr. Sami said. It's because I think if we continue to think of this as a population that has all of these risk factors, that narrative can be co-opted very easily. And if we don't have a perspective of personal humility and vulnerability ourselves, we can really feed into a damaging narrative. And so I just want to say as a researcher, that also needs to be extended to us as well. And Brittany, did you want to say something?
Yeah, I think as researchers, the data issue is one of the big issues that we're facing in this new administration, where if we can't measure and quantify and show how these injustices are impacting our communities, then they are not happening, right? Or it seems like it's not happening. But at the same time, these data sources are at risk, for one, and also they're risky to do. So these studies that have a lot of immigrants and vulnerable populations in them, in the past we've generally avoided taking down things like documentation status, but it's not beyond the realm of thought that an administration might try to get this type of information. And as researchers, I think we need to safeguard this data even more. And if it is putting populations at risk, it's better not to put them at risk than to collect it and put people at risk, right? I don't know.
So I wanted to ask a follow-up question to this, and I think Dr. Montoya, you sort of touched on this, is that this is not, health disparities have existed a long time. Marginalized communities have been in this situation for a long time. Is there something unique about this situation that you've noticed, or do you think we're just talking about it differently now?
I think Dr. Montoya was really perceptive in the fact that things haven't changed that much. So you mentioned as well, we have structural racism here, and that's a very clear thing, but it's a concept to a lot of people. And I think in a diverse area like California or Orange County or Southern California, you know, that structural racism is not something that you may necessarily understand or see, but it's clearly here. I also grew up in Santa Ana. I went to the schools here. My father is actually a Mexican Korean. He grew up in Mexico and he immigrated to the United States in that context. And there's a lot of layers to all of our experiences that make this community and our state and our country diverse. And we know that, but we also don't understand just like if you don't come from a place of experiencing the racism to your family and your individual self, or a place where you know what that racism is, and maybe your family or your friends or, you know, have some perceptions that can be racist. And, you know, that's pretty common. And I think the thing is, like, we don't identify it or understand it. And we don't know exactly what that may look like or be able to express that. But yes, things haven't changed very much. I mean, Black and brown people die every day through police brutality. And we've seen that a lot more. And I think times have changed in terms of kind of the exposure, but times have not changed in terms of how people think. And for us, I think moving forward, that's a real challenge because it's not fighting a new fight. It's not like, oh, you know, I think what's really amazed me, because I'm a little old school, so like I don't have Facebook, I don't know how all this stuff works, and like you see the social media like momentum, like the hashtag, you know, there's a group I work with called Undocumedia, and they have amazing Instagram posts and memes and all this, and you know, folks are really fired up about advocacy and social media. And then all the women's marches you saw, all the marches for immigration, May Day, people are out there doing a lot of different things, but it's not a new thing. And I think for us, it's really understanding where we can be effective and pool our resources together and kind of beat it at the root. And I think that's the real scary part. Where is the root?
May I follow up with that? That was such a great segue to the thought was in my head, that it is at the root. And if you ever look at a grass root, have you ever looked at grass roots? Are they individual blades? What do they look like? They're meshed. And I think the one thing that I would say for my work in Orange County over the last decade or so, the one thing that's shifted is that we've begun to recognize those intersections. The one thing that shifted is now Latino Health Access Program Manager calls me as a Persian American and says, come join. We are having a immigrant rights rally. Come join. We're having some legal advice and we're welcoming the Persian community. Let's do this together. That's what shifted. What is shifted is we're reaching out to each other beyond our silo issues and beyond who we are, who we identify with. We're reaching across the aisle, if you will. And we are coming together in a way that makes those grassroots enmeshed and embedded. And for me, as a scholar of integrated systems and intersectionality, it brings so much motivation to the work that I do at the local level. Because I understand the vulnerability that you talked about. We have to be in that space too. When those travel bans occurred, even though my family, most of my family is an American citizen, but that fear came up. I moved to the United States right around the time of the Iranian Revolution because I'm a Baha'i. My religion is persecuted in Iran. So imagine coming to the United States at the brink of the Iranian hostage crisis and getting beaten up every day in school because I was an Iranian. As a little kid, I'm like, dude, I just escaped this because everybody was beating me up back home. What the heck? So the conversations are shifting in that people are asking more questions. And people are saying, come, we understand your vulnerability. We share some of that vulnerability. Let's do this together so we can address this issue. So I feel like although the issues have not really shifted, and we have been brown and black folk have been dealing with this for a long time, but I think the connections between our communities are what's making me excited about doing this work moving forward. The resilience that's built together is so different than the resilience that's built on its own.
And it's hard. Don't believe for a minute that it's going to be easy, and that the roots, as they get entangled, don't compete with one another for soil, for nutrients, and for water, especially when it's scarce, especially when the sources of those nutrients in that water are withholding it at every turn. It's hard. And we have a history of fighting one another for scarce resources, for the crumbs that are being thrown at us from governments. And that doesn't matter who the government is. If you're vulnerable, we've been fighting one another, and we have developed deep pattern and ingrained ways of being with one another that are not socially inclusive, that are not welcoming. We, as a knee-jerk reaction, go to non-welcome, to they're not me, my group first. That's what we've been skilled at doing for as long as I've been alive. This new thing, though, is what we are struggling to do. And one of the questions that was pre-circulated was, what can we do? I am as excited as Dr. Sami is about the resilience together and the community spirit and the beginning to see that we are all in this togetherness. And there's forces stacked against us to make us think that we aren't in this together, that we are all different and differently vulnerable. One of the reasons why I opened with the let's think about how we all are connected is because the degree to which we can connect to our own vulnerability is the degree to which we actually see and feel and enact and embody the connections that are required to overcome the structural impediments to our connection. And if we can't learn those lessons, and they are deeply personal lessons, as you said, we've all been conditioned to see one another through sociological lenses of deficit and racism and sexism and homophobia and fill in the blanks. But to connect with our own experiences and therefore with one another is the way through to be able to even say, I don't know what to say right now, but I want to. I want to do something. I want to collaborate with you. I want to have a conversation from a place of sincerity. Not because you think it's the right thing to do, but because you get it.
So if I can ask you now to think about what's next, and I think we've sort of been, talking about lots of different things, but if you could think about a policy or an aspect of either sort of the political or social environment or something that you see on the horizon that has you worried, that has you a little bit concerned about the health of the communities that you work with or that you do research with.
I alluded to this a little bit earlier with my comment on data, but for example, some of my research focuses on environmental justice for minority communities. So our minorities have traditionally tended to live in more polluted communities, to be more exposed to environmental toxins. So there's a data set that I use called the Toxic Release Inventory, and this is a publicly available data set that you can look at and actually see individual chemical polluters and see how they're impacting your local community. And my fear is that in this new administration, there's this war on science, as was alluded to, where this data is slowly going to be either stripped away so that we can't no longer see at these fine resolutions who is being impacted. We can't define and quantify who's being affected by things like environmental pollution or climate change, and that this war on science is going to lead to just our communities becoming invisible. And so I think that's one of my huge concerns, is that we need to safeguard and protect these data in order to combat health disparities.
So one of the things that's really immediately resonating with me is that, as some of the other panelists mentioned, health is in all places and health is everywhere, right? So your physical body, your place in a community, your mental health, your ability to thrive and be economically viable, and how you contribute to your family and where you live is all connected to your health. And I think clearly more than at any other time, and not because it's a new fight, not because we have a particular leader of the country, or because administration is targeting different things, but we know that all of these compounding factors are affecting your health. So it's hard for me to say that there's just one policy that I'm looking for. Obviously, there's a war on climate change. There's a war on environmental justice right now. There's a literal war against people of color in terms of what describes an immigrant community, in terms of what the administration describes as an immigrant, and what those policies may look like. And there's also a clear war on just your health and well-being as an individual, as part of a community, through the American Health Care Act, which is a Trump Republican proposal to repeal the Affordable Care Act. And just, some numbers very quickly is that obviously through this particular proposal, 24 million Americans are going to lose health coverage just flat out. And that's folks who have been able to get healthcare coverage for the first time. A lot of communities of color, a lot of vulnerable communities. For example, in the state of California, one thing that we did is that we expanded Medi-Cal to low-income adults. For the first time, if you're not a child and not a senior and you qualify for Medi-Cal, under your income limits, you can actually get Medi-Cal. And that's something that the funding for is going to be completely eviscerated through the American Health Care Act, the AHCA, or the Trump Care, as some folks call it. But beyond just coverage, I think there's increasing ramifications and compounding variables, because, for example, if you are from a mixed status family, but you have Medi-Cal, and you go to school, and you have a lot of different things where the defundment and disinvestment from the administration are going to affect you at different levels. Obviously, we have an interesting education leader in the administration now. There are clear priorities that kind of resonate with the fact that this is all basically the same message. It's structural racism, and these are all kind of the proponents and the ways that it's playing out. But definitely, for me in my work currently, the healthcare issue is huge. California has made a lot of strides. We've covered undocumented kids. There was a budget ask to increase Medi-Cal to young adults up to the age of 26, and we wanted to see that forward this year. We wanted to restore adult Denti-Cal so that folks could actually get dentures. All of these things that we wanted to do are no longer as viable if we lose $15 to $20 billion in health funding in the state of California alone. So that's a clear concern for me, but obviously every policy that is targeting low-income communities of color are compounded into the health aspect of how we live and thrive in our communities. So I think for us, and something that Dr. Montoya said as well, is we really need to think about how we are recognizing each other and understanding that all of these issues are as one. I think the fear for me is that there are a lot of people who are very excited right now. But I will tell you from the advocacy field, all of my folks who do this 24/7, and they are quite literally doing this 24/7, there is, the increasing kind of attacks. It's really hard to deal with personally, even as an individual. So self-care, understanding, and really connecting with folks is going to be important, because if we built this up, and we're starting to build it, and it's not to say that we're even there yet, to be frank, but if we're building this movement and we are seeing those intersectionalities, it is too vital to lose. And I think that's the point I want to make as well, that we need to really think about sustainability and long-term longevity for fighting the root cause of the structural racism as well.
Can I ask you really quickly to define structural racism for people who aren't familiar with the term?
Oh, sure. So structural racism for us, I think particularly, and I will define it in my personal terms, but Of course, our academic folks can help us define it in the more academic terms as well. But structural racism for us is that in every kind of implementation of your life, so the way that you live, you breathe, you interact with people, the way you go to work, the way that you're defined as a person, in this country, we have structural racism. Just the fact that you are not white means that you are not going to make as much money, or not white male, to be very specific, but you're not going to make as much money. You have lower chances of getting through college. Your hiring may, I know there's a lot of diversity initiatives as well, but it's not the same. And you don't have equal access to all of the opportunities that if you were not a person of color or from an underserved community, you would have. And you could elaborate more on that, on the academic terminology, I'm not sure.
Mentioning that, one of my issues was going to be resistance fatigue, actually, because this is not a flash of light. This is a wildfire that has to burn. I mean the movement. And it has to burn down structural racism. And resistance fatigue is a real thing. It's not just 24/7. I feel like it's 89/7. Do you know? I mean, it's you, especially when you said kind of be aware of your vulnerabilities. As a scholar in this process, I think of myself as, how do I use my PhD for good, not evil? And in that process of wanting to use my PhD for good, not evil, I'm in the community a lot. I'm always trying to help when there is an ask. I try to make it happen. And sometimes that is literally 24/7. It's like the job doesn't end because I have to go into the field, or I want to go into the field. So that's been a big challenge. How do you incorporate self-care in a time of crisis like this? Understanding what you need to sacrifice and what you need to prioritize. Those things are very real in my daily life. If I do this, it'll take me away from my publications, but that's a sacrifice I have to make, So it doesn't matter that this data is not useful for me to publish. Doesn't matter. I got to give this to the community. They're going to need it. So resistance fatigue is a huge issue, and I guess so is scholar fatigue in accompanying communities. That's also an issue. Protecting, safeguarding data, or just making sure that we're addressing structural racism and providing resources. The other fatigue issue that I see that I think is more pertinent is I call it a crisis of consciousness. We have this embedded mentality that somehow economic growth should receive impunity over everything. And this has become an issue in the community at levels that I've never seen before, where even people of color are abiding by this concept. As long as it's economic growth, it doesn't matter. Everything else can fall to the wayside because economic growth gets impunity. How do we change that mindset? In Santa Ana, they have engaged in a process of creating a community land trust because they're tired of having unused parcels of land go to developers that are only aiming for economic growth. And they're like, no, we want parks. We want mercaditos. We want skate parks. We want places to interact and socialize. And just because they're not going to give you tax revenue doesn't mean they're not beneficial. So I've seen this in spaces throughout the United States, that people are struggling against this mentality that economic growth, for some reason, has become an ethic. And how do we challenge that to make sure that social justice, compassion, humility, the other ethics that we have to abide by as human beings, are given just as much priority and precedence? And I've seen this, and I've seen us struggle with it because, as you mentioned, it's hard. Especially if you work in planning processes in the city council, who don't like to hear something about, oh, there's not going to be tax revenue. Oh, then I don't want to do it. There is no such thing as trickle-down economics. How many times do we have to study this to quote-unquote prove it? It doesn't work. So how can we change the conversation at the policy level, away from impunity from economic growth? Sorry. No worries. How do we, take two. How do we change the conversation away from economic growth and ensure that equity and social justice, compassion, love, all these are part of the conversation?
For me, I worry about that you're sitting there going, what can I do? This sounds big. And little old me, I'm just trying to get through college. What can I do? And if this were a class, I'd have you talk to a partner right now for about 2 minutes. And I would ask you to tell each other just one thing. 2 things that you have done this week that took care of somebody else, something that they needed, an act of kindness that you did. Just 2 things. And then we'd come back and we'd talk about it, and I'd make a list of those things up on the board. And then I'd say, you want to know what communities need right now? Right there. And you're already doing it. So you think you're not able to do it? What can I do? Those small, it sounds trite, but those small acts of kindness and caring for other people come from someplace in you that needs to be the place from which you act. Because if you act from some other place, it's not going to be helpful. I've been studying people like Grace Lee Boggs, for example, those of you who know her work, who've been working in community through, she got her PhD in 1934. So she lived through so much in her life. And what she said towards the end of her life was, what we need is a respiriting. And what to me that means is a connection with our connection. To ourselves, to one another, to the world, to other species, and if we have an idea of something greater than ourselves, a connection to that too, or not, but a connection. That's what respiriting meant to her. Because you know what? The other thing that I worry about is that we think the government is going to save us. I don't think the government is going to save us. I think we are going to save us. I think, as Sweet Honey in the Rock said, we're the ones we've been waiting for. And I worry that we don't get that lesson yet. That we're waiting for Superman, another movie, right? That we're waiting for somebody else or some other group or some panel to give us the answers so that we can be certain that we're doing the right thing. And then I just ask you to go back to what you imagined a minute ago, the 2 or 3 things that you do to take care of somebody else, and go, that's where you start. You already have the skills you need.
I want to leave some time for questions from the audience, and we have about 5 minutes left. So if I can borrow this, and then you guys will share amongst yourself. Maybe Margaret, do you mind? If anybody has any questions now, we have about 5 minutes, and if anything you'd like to hear the panelists talk about or elaborate on.
Not everybody else.
Yeah.
Let's see. I've got a question, but I'd love to give the first one to one of you guys. Anybody else?
I had a question regarding the work that we do as researchers, as whatever profession it is, and then kind of we mentioned working with communities and how they are, I think people say, we're empowering communities, but for the few years that I've been working, that I've been in school and being associated with some of the stuff that communities do, they've been empowered for a long time. And I think one thing that is missing is giving it a voice. And so as I sit here, I wonder why there's not a community panelist who talks about the issues that they believe represent those communities. And it's not a criticism of the panel at all, a criticism of how can we, what can we develop in terms of how we see us as an institution, so that we can incorporate communities and be a given that they're part of the work that we do, because that's what we're doing, right? We're trying to understand the issues, and yet they're not present here. So just a thought.
Thank you.
Thank you for asking that question. That is obviously pretty obvious. So I would say part of my work, I work at a nonprofit organization that works directly with community-based organizations and community leaders, is we are really excited to coordinate and partner with academics because data is important. And data is important for the reasons that are not ideal. The economic impunity piece is an argument that actually does work with policymakers, and unfortunately that's For some policymakers, that's the only argument that works with them. So we need actual data. So obviously data and research and practitioners and folks who work in the field are very important in terms of being able to influence policy. So we appreciate that space. But if we're being really conscientious of community, and I have to be honest with you that empower is my least favorite word, because it really, like Dr. Montoya said, puts a distance between you and them. The communities are them. I am here, and I'm going to do all this great work and empower these folks who are not me. And that is why empower for me, personally, is not my favorite word, because you, as you mentioned as well, you have to live, walk, and understand the people that you work with. And then, as some of our panelists mentioned as well, you have to understand and care and make those connections in order to even have a sense of the work that you're doing and what that means in the context of your career, as in your actual occupation that you do, but also where your place is in the community. But I think in terms of working with community members directly, really having that open mind of where the needs are and how communities work is very important for us. I think as a basic community organizing 101, some of the things that I learned through my work in the last 8 years is really trying to make sure that personal connection is there with a community leader or an individual before any of this happens. I'm not gonna go out to, I'm from Santa Ana, but I'm not gonna go to like Bristol and you know, ask an individual on the street and say, hey, do you wanna talk about your life at this UCI panel? If you think about kind of the barriers to even get here, so I work full-time as an advocate at a nonprofit organization. I drove here from LA in a car. I have a car. That's my privilege. I have a mode of transportation in Southern California that unfortunately is the only way that transportation works in Southern California. That's a privilege, right? I came here. I had an hour of time in the middle of the day on a Monday to come here. That's a privilege. And I am obviously, you know, privileged enough that I've had education. I am really privileged to do what I love as a job, as a profession. And I think all of you can speak to that as well in your careers moving forward. But when we think about our communities and where they are and where they live and how they survive despite these compounding threats and our communities, if we really want to work with communities, we need to work with them. So I'll just tell you, you know, like if you want to invite a community member to your panel, I don't think a panel is the best place, to be honest with you. Like, I don't think, you know, not everyone's going to be comfortable to come up on a stage with a recording and lights in front of, you know, park in the structure that I didn't know how to get to this building and look at a map and like figure things out. Those are all barriers for people. And if you live in a community and live with people and work for people, I think, you know, there's a lot of different ways to make sure that you're creating the pathways that you're working within their communities and within our communities, not just inviting people to come and like talk to us. So we.
You just described to me, you know, in terms of like how you were describing structural racism, you know, the policies, the regulations, that it's just, you know, we have set up systems that don't allow us to have communities, you know, be part of this discussion. It's just a thought.
I'm so grateful that you mentioned that, because I wanted to also give credibility to the organization, to the community, what do we call UCI, Health and Justice Advocates, because they tried to do this in the evening, and they had some structural barriers there. So there was a process where they really tried, and they took advantage of the fact that we have this seminar series at this time, because I think they wanted to invite people from the community, but because of the issues that were mentioned, it was tough. Now imagine if we had a system where we could go out to the community. Wouldn't that be amazing? In a recent community dissemination forum with OC Pitch, it's a CDC-funded project, and we are just one of the partners among many in that process, but our community partners said, we don't want to go to UCI. We want you to do it in the community. And we said, of course, right? So that conversation has to happen at the granular level. It has to happen there, and you have to be willing to say, yeah, we don't have to be in the Game of Thrones. We can go out into the community and accompany one another. The other thing that I wanted to say is I've started rethinking my idea of community. It's not just a noun, it's also a verb. There's a great, I think it's Dr. Horton who said, we make the road by walking. I've been thinking post-inauguration, we make a community by organizing. And the more intersectionality and the more we show up in the community, whether it's to city council, at a city council meeting, or whether it's with a group of youth who want to make Santa Ana more skate-friendly, or it's to show up at a food bank and make sure that you speak the language of people who are afraid to come out because they're undocumented or they're new refugees and they don't know they can get food without having to give their life story. Anything that we do, I've realized post-inauguration, we make the community by organizing.
Thank you. Thank you so much. So, and on that note, I'd like to thank all the panelists for coming, and thank you all for being here and listening to what they have to say.